I think the important message from GRIFFIN was presented by my colleague Dr. Jacob Laubach, and this was a randomized phase 2 trial, well-sized, almost 210 patients, assigned to either RVd plus Daratumumab with transplantation or RVd transplantation and then more RVd and Len maintenance alone. And the important point was patients who were assigned to the Daratumumab would receive Daratumumab as part of consolidation and maintenance. And what Jacob presented so nicely at this meeting were the updated results with, progression-free survival data. So to summarize the overview of the study, patients who received RVd Dara during induction, consolidation, and maintenance had substantially improved quality of responses compared to the RVd transplant arm without the Daratumumab. And what was so encouraging was to see doubling of MRD rates, particularly during consolidation and maintenance. This is really very encouraging because it suggests that continuous therapy, not simply just intensive treatment followed by then a cassette of treatment, rather the continuum of therapy, was making an important difference to patient outcome. Now, whilst you can have response rates and MRD rates that are encouraging, what's going on in terms of progression-free survival, but what we showed there was really quite remarkable. Essentially a 90% progression-free survival with follow-up at 3 years compared to approximately 80% for the non-Dara containing arm. So both arms performing very well, but nonetheless the Daratumumab showing a strong trend towards an improved outcome. And what was so encouraging as well, that this did not come at the price of increased side effects or a tolerability profile that was more challenging. So the GRIFFIN data overall producing really quite convincing evidence and meeting its primary endpoints in every way of demonstrating clinical benefit to the use of the 4 drugs, the quadruplet, over the triplet incorporated with transplant. So we're very hopeful that this will inform practice going forward.